Welcome today to our NHCC and Educational Committee Roundtable Forum on Cannabis 101, where we bring together medical professionals to demystify the health and wellness power of cannabis, to break down the Latinos community long held cultural taboos and beliefs on cannabis. My name is Antonio Valdez, and I'm the Executive Director of the National Hispanic Cannabis Council. We are here today with our two other co-hosts, Dr. Paloma Leftfeld and Dr. Steven Dahmer from Vireo Health. Dr. Paloma is an MD, MA, is a lifelong cannabis student, an advocate who serves as the new Senior Director of the Clinical Science and Partnership for Goodness Growth Holding.
Antonio, thank you so much for having us back. We're so happy to be here and huge fans of the National Hispanic Cannabis Council. Thank you for providing this amazing education to your members. We appreciate you so much. And it is my great honor to introduce my esteemed colleague and friend, Dr. Steven Dahmer, who is a board-certified family physician. His passion for health and healing has taken him around the globe. He's also a fellow at the Arizona Center for Integrative Medicine. For over 2 decades, he has studied the relationships between plants and people, working closely with diverse cultures and documenting their uses of plants and other integrative therapies. Since 2015, Dr. Dahmer has served as the Chief Medical Officer of Goodness Growth Holdings, a physician-founded, patient-focused company dedicated to providing best-in-class manufacture and clinical utilization of cannabinoid-based therapies. For Vireo Health, he oversees clinical research partnerships, which he'll speak on today, pharmacovigilance, physician outreach and engagement, and over 200 employees, 600 employees now, providing education, support, awareness, and a compassionate patient experience to over 100,000 unique patients utilizing medical cannabis. Dr. Dahmer has given over 200 lectures on cannabinoid-related medical topics and is involved in 2 large-scale clinical trials studying medical cannabis, opioids, and chronic pain. Dr. Dahmer is also an assistant clinical professor of family medicine and community health at the Icahn School of Medicine at Mount Sinai and director of holistic primary care, practicing integrative medicine in Scarsdale, New York. So excited to have all of us back today. Hey, Dr. Dahmer, broad question, but how does cannabis help with chronic pain?
Before we even jump into the cannabis and chronic pain question, I do just want to say that it's such an honor to be here. I haven't had a chance to say that myself, and huge fans of NHCC and Antonio, thank you again for this platform and to share what, Dr. Paloma and I have been learning over 7+ years now in working with this plan. And I will reiterate what I said on the first, that, the Latino community is very near and dear to my own heart, and that it makes up the majority of even my own family. And again, so I'm not Latino by birth, but certainly directly in my own family, hold the community near and dear to my heart. And education, as we all agree, is absolutely key surrounding the topic. And I do just want to say that I think all cultures have taboos surrounding this plant, and for good reason. Even myself growing up in the Midwest, we think of someone getting stoned and we think of apathy and making you lazy and many things that we have been trained to believe and have never been shown any other potential aspects of this plant, which is what we want to explore a little bit more today. And Dr. Leifel, getting back to your question, right? So how does cannabis help with chronic pain? This is chronic pain, and I have my white coat on not just for show. I saw patients all day today, including those with severe intractable chronic pain. And if you ask anyone that suffers from it, and many of us will, or any physician that treats it, it's incredibly complex. And there isn't, one single mechanism by which chronic pain occurs. And it has, inputs from mechanical to burning our hand on a stove to our own interpretation of that. We sometimes were taught in med school that if you catch the winning strike for a baseball game, that pain you feel is going to be very different than if your mother slaps you on the hand for doing wrong. And so even our interpretation of pain can be incredibly different over time. What we do know in terms of chronic pain in cannabis is that we know that cannabinoids, which are the fancy term for these active constituents, basically these medicines in the plant, They have both analgesic, which means pain relieving, and anti-inflammatory, so decreasing inflammation, which, most of us really believe is at the root of all pain today, is some form of inflammatory process or inflammation. We know that cannabinoids, both through the nervous system and the immune system, can impact pain or analgesia and inflammation. So two of the core concepts related to chronic pain. And again, it's not always clinical research, meaning research in humans that can support that. But from the evidence that exists, we know that there are mechanisms of action by which cannabis can be a pain reliever.
Thank you for that. And can we talk about what some of the research, clinical or non-clinical, says about cannabis, and maybe speak on some of the research that you've been involved in?
Absolutely. And this, again, I think we have a number of loaded questions, so we'll try to unpack them a little bit and not talk too much, but try to cover, so many different aspects. And I'll speak maybe from a personal standpoint of, as a physician, why would I even be interested in cannabis? And I just want to be very frank. 7 years ago, when I made the decision to enter in this industry, I had to have a family discussion. I had to state, wow, I'm going to be dealing with a Schedule I substance. I spent my entire career and a lot of money getting an MD degree that could be potentially at risk. Why the heck would a physician even think about making this leap? And I'll just explain a few of the things that really attracted my attention, and then let's speak to the research. One is, this plant has been used for thousands of years to treat pain. This is not something we recently discovered or is some newly created medicine. It has a very long track record that humans have been utilizing this to treat pain for thousands of years. And over, even including today, we hear from patients, and even research supports this, that patients report that cannabis helps them with their pain. And in modern medicine, we oftentimes negate these, single patients responding because we want higher quality evidence, which we'll talk about a little bit more in detail. But for me, that's what really moves the needle, and that's what I do on the front lines all day long. Is the patient in front of me, I make a recommendation, and I see how they do with that. And when over and over we see patients responding positively to that, that's a signal that we should be investigating this a little bit more. And then, I do want to just mention too that, the fastest growing demographic of those patients utilizing medical cannabis is over 65. And so again, another stigma we kind of bring to the table, we think of someone going on a snowboard trip or going to a concert, which is not the typical patient that we're seeing in our dispensary. It is the elder population, which I have tremendous respect for. And sometimes when I see them gravitating to a treatment, it also raises my eyebrow to look a little bit more deeper. And then I'll finally say that one of the big things in medicine that kind of turned the needle or turned the dial towards looking at cannabis and chronic pain was a very large report that anyone can find for free online, that was generated by the National Academy of Sciences, Engineering, and Medicine in 2017. And they looked at over 10,000 different abstracts. So looked at a very thorough look at the literature, and came away, and this is, again, printed on their website and has been shared since 2017, that in adults with chronic pain, those who were treated with cannabis or cannabinoids were more likely to experience a clinically significant reduction in pain symptoms. A very large statement in 2017 to make. And since then, what we've been trying to do is make sense of a very complicated topic. And that is because this plant essentially has, and Dr. Paloma and I often say, 1,001 medicines in it. And again, the number might not be that high, but the meaning is that it's a very complex plant that has multiple medicines in it. And so it's kind of a combination medicine, also given in many different forms. And many patients probably listening today, if they've gone to a dispensary, can be overwhelmed at the choices that are in front of them. And I think that, what the research is saying again is that this is neither a panacea, meaning a cure-all, right? The greatest thing that ever happened, which we certainly hear in popular media as well, but it's also not a poison, right? And that's that stigma side of things. And like so many things in medicine, every medicine that I use as a doctor is a double-edged sword. If used correctly, it can certainly help patients. If used sometimes in the wrong dose or the wrong form or with the wrong message, can cause harm. Cannabis is exactly the same and should be thought of as one more tool in our toolbox for those suffering with chronic pain to explore in conjunction with their medical team to find a way that it may potentially benefit them. And not everyone will. There will be some patients that don't achieve or receive a benefit, but we should be open and honest about that in that exploration. I talked quite a bit there, and so I don't want to keep rambling on. Paloma, maybe talk a little bit about research and some of the things that you've seen, and then maybe we'll get into some of the research that we're working with Montefiore, Albert Einstein College of Medicine, and others on.
Absolutely. Dr. Dahmer touched on the different types of pain and how we all really experience pain so differently. Antonio experiences pain differently from myself, based on gender, based on other medications we're taking, based on age. And pain is one thing I want to touch on is something called multifactorial. It's not just the pain that we're experiencing, it's all these ancillary symptoms, whether it's insomnia, some mental health issues, as well as hunger issues as well. And this is why cannabis can really be a great treatment option, because as Dr. Dahmer mentioned, it is a plant of 1,001 different medicines. And that's important because cannabidiol specifically, can treat some of the mental health issues, the anxiety related to certain types of pain, insomnia. There's lots of studies that show or suggest that cannabis is great for that as well. So again, really having that be a part of your treatment regime for pain, it can be incredibly beneficial. As Dr. Dahmer mentioned, there is, a lot of us don't realize, physicians and scientists don't realize that there is a lot of research out there. There's observational research, not as many RCTs that we talk about as being the gold standard, but there is a lot of case studies and people that report that cannabis really works well for their pain, specifically with opiate and cannabis use. Although there is a certain population that opiates are absolutely necessary for, unfortunately, in the United States, we do see a huge uptick in overprescription, of course, opioid-related deaths in the United States. And it's imperative that we talk about the fact that cannabis can work in conjunction with opiate medication to really reduce pain in particular patients. And this is important because when they work together, the sum of the parts of the cannabis and the opiates can actually work so that you can decrease that opiate dose while using cannabis. And that's some of the research that is so important and some of the research that we're really participating in. So I'd love to talk about that a little bit more with Dr. Dahmer as well.
Hey, Dr. Dahmer, I have a quick question, and in this now, I'm going to bring it back to the Latino community. You mentioned that you have a lot of patients that are over 65, senior citizen patients, I should say. How do you see the resistancy from the Latino community patients that come in to see you, in terms of you're a medical professional, you're guiding them to the best that you feel in terms of, because you mentioned it, there's a double-edged sword on any medicine that you give, but the resistancy and how, from these patients, how do you overcome that from when they adopt it? In other words, is it word of mouth? All of a sudden, do they not that they found the miracle cure, but this works better than the alcohol, marijuana, and radish medicine that I've heard so many folks discuss? And because now what you're bringing is the science, right? The abstract is there, and it can be in a pill form, it can be in a smoke form, edible. So how, I guess, to learn from you to educate the Latino community, how do you see that happening, what I just described?
Yeah, I think that's a great question, Antonio, and I think that the answer to that lies in, really at the heart of kind of what any health professionals will do, and that is to explore what are the hesitancies and what are the barriers. And I'll give you maybe two top ones that I've come across. One, you hit the nail on the head. I don't want to inhale, smoke anything. And everyone kind of associates, and this I think has to do with media. Every article I see about cannabis, there's usually some big puff of smoke and someone holding something in their mouth, no matter what the article is about. And so the first thing that we will explain is that the delivery forms can include a tablet or a capsule or a tincture or, many different forms that don't have to be inhaled. And so I think that's a big thing that many people, just hearing that, again, eases them slightly. I think the next...
I guess not to interrupt, I apologize, but simply to create awareness of alternative methods.
Yeah, yeah,
What I'm
yeah.
hearing from you, because of the stigma that everything has to be not a Cheech and Chong, but a up in smoke, a puff, as they would say.
That's all we've seen, right? For most of us, our entire lives. And so that's what we think of when we think of cannabis. And we need to reorient that no, that's not the direction that many of the medical patients will go. And there are other delivery forms. You know, I'll say along those lines, I think that many patients are just even surprised making their way to a dispensary, and they find that oftentimes it resembles a doctor's office. It's a very professional atmosphere, that it is not, you know, in some dark corner or something that they're ashamed to go to, that it's very open and full of education, and oftentimes even, you know, licensed pharmacists on staff and other medical professionals to help answer questions related to that. And then, Antonio, I think probably the most important of all of those, and we hear this across the board, but including Latino community, is this tremendous concern. I don't want to be high. I don't want to get high, right? And I think everyone has seen maybe someone that's been under the influence and are concerned, you know, for good reason, that that's not how I want to be seen, or that's not how I want to live life. And again, coming back to this importance of dose, that is true for the vast majority of patients in a medical program. And there is no need to be high for the analgesic or the relief that someone potentially could feel from cannabis. And so that's something we tell patients over and over. Our mantra, as we try to gather better evidence, is let's start low, let's go slow, and let's stay as low as possible. And oftentimes we're talking about that THC part of the medicine, right? Which is the cannabinoid that can make you feel high, that we're going to come up to that pain relief, but without the fancy term is the psychoactivity or the intoxication. And that's where most patients are going to find their sweet spot, and their ideal dose is where I don't feel high, including even those around me don't perceive a difference from me, yet I can find some pain relief. And those are probably the top three that I see.
That's interesting. I thought one of them would have been the role of shame. In terms of the culture, now culturally speaking, because even though it could be the miracle drug, it's still the stigma behind it. And it's, again, I think just talking about it, we're demystifying the science behind cannabis. And I think if anything, it's erosion, right? We have to start slowly. But this is thank you. Thank you.
Yeah, and I think it's a great point, because we're just even demystifying the plant. I mean, just even each one of us should take a step back when we see that marijuana leaf. What do we think? And I had to be very honest with myself, you know, and still to this day, all these ideas come up that have been planted, you know, in my head for decades, and that's changed obviously for Dr. Layfeld and I, as we've had a frontline role, and then see those patients that respond. And that's really what kind of drives us to this day, are those patients that do respond to this plant in a positive way. And I'll be very frank, the majority in the programs where we operate oftentimes are those with the intractable pain, meaning that they've tried everything under the sun, and for the first time find some relief in their life. And again, I don't want to paint the picture that it is a panacea or that it is a cure-all, but it is pretty remarkable, the stories that we hear on a daily basis, which leads our research efforts to better understand and demystify this plant.
Yes. And I think that's the science every day just keeps getting better and better. And I'll just leave it with edibles. I mean, in other words, the simple fact that you can take a pill like any other pill from your medicine cabinet, but it's different. It's a CBD pill related, or a THC pill if you need it more for sleep, because like you said, there's many functions that this plant has. But the fact that it's not a stigma, it's not something that you have to go out and do in the backyard because you're going to reek the house. No, it's simple as that. But with the science, knowing where it's going to impact the body.
Yeah, and maybe we'll speak to that a little bit. And I think that, Dr. Paloma hit, was right, spot on in terms of one of the things we're looking at closely with patients that utilize medical cannabis. Two things. One is a potential impact on opioids that we know is an absolute epidemic, and everyone is aware of the havoc that opioids are wreaking in our society. To have an alternative or something that may even decrease dose of opioids would be a feather in our cap. The other is quality of life, and Dr. Paloma, you spoke to that. Whether that is decreasing overall stress or improving sleep, or so many things that contribute to just my quality of life. That's another area where we see cannabis having potential impact. And we are supporting, and just recently had our own webinar with, finally, after I think we're at 4+ years now of working on research, preliminary results that Dr. Julia Arnston from Montefiore Albert Einstein College of Medicine, she is the principal investigator of the MEMO trial that's looking at hundreds of patients with chronic pain in the New York State Medical Cannabis Program, and watching them over a long period of time to see how does the cannabis impact their opioid use? How does the cannabis potentially impact their pain? And looking at a number of validated measures, from potentially cannabis use disorder. Does it cause problems in their life related to their cannabis use, to even impacts on anxiety, depression, and even PTSD? And this is just a fantastic study that we are done recruiting, but still following the latest that were recruited. We have to follow them through to the end before we actually have data on whether it impacted opioid use of those patients with chronic pain. But this is very exciting research that is around the corner, and we hope to host Dr. Arnston again when we have that data to showcase what it does show.
Absolutely. And speaking on that a little bit, because we've already, danced around it, but with regard to safety profile, you mentioned that cannabis is not a panacea, but can you kind of speak on the safety profile of cannabis versus opiates versus other traditional pain medicines?
Yeah, and I think that, we've mentioned many times in the lectures that we've given, and even previously, one of the big wins for cannabis is something we call the LD50. And really it's virtually impossible to die from a cannabis overdose, right? And whether you ingest that by mouth or inhale that, this is very reassuring, again, in the midst of so many deaths related to medications, that cannabis won't contribute to that death count. That's not a reason in itself to accept any medicine, but it is a good starting point in the midst of a pandemic and so many deaths related to medication overdoses. The safety profile compared with other medications, this is yet to be seen, in my opinion, right? The fact that there aren't deaths already makes it, for me, a better option than opioids as a physician. But there are many medications that we use for pain, and I think that's part of what the research needs to figure out. And I think the trouble with that is that we can do some of the large-scale studies, but this is really a personal matter. And that's where, again, I like to think of cannabis as one more tool in the toolbox for those suffering from chronic pain. The best evidence to date is truly with neuropathic pain. So if a patient suffers from neuropathy, which is very difficult to treat, even more so should be inclined to inquire or to explore cannabis as a therapeutic option, and then should be, done in conjunction with a healthcare provider. How do we decide that truly the benefits of utilizing cannabis outweigh any risks that are associated with it? Monitoring, just like any other medicine, that this is doing me good, right? I'm creating a good relationship with this plant over time, that it contributes to my quality of life and my overall health.
Gee, it sounds like we need a session just on responsible dosaging, and learning more, because I've never had heard that never advisable mixing cannabinoids with opioids. And how the body reacts, but if you're taken in the right dosage, they might work as a great complement. Because of these stereotypes and what we hear. But you could not have said it clearer that the deaths from overdosing from this plant is very non-existent, versus an accidental overdose of an opioid, which, as you know, today is up there with automobile accident deaths. I just read, And it's not a funny statistic, but it's a reality statistic.
Absolutely. And Dr. Dahmer and I always, bring up the stigma with plant-based medicine versus or cannabinoids versus opiates. Anybody can get an opiate prescription and walk into a CVS and pay $6 copay and get a bottle of opiate. A pharmaceutical that kills over 100 Americans every day. Yet the stigma associated with walking into a dispensary and getting this cannabinoid-based medicine that, again, is almost impossible to die from, there is that stigma that is blocking them from going into there and getting a potential, medical option that really has the potential to calm some of these chronic pain symptoms. I do want to mention that the research that Dr. Dahmer participates in at Montefiore is in the Bronx, which is designated as a medically underserved area. The Latinx population in the Bronx, where Montefiore Albert Einstein College of Medicine is located, is over 50% Hispanic.
Higher, I think, yes.
We do provide interpretation services for all research participants, for all people that are using our medicines, and it's incredibly important that we provide this medicine at little to no cost through our research to our participants. Again, these, as you mentioned, this isn't just smoking, this isn't combustion, these are soft gels. So it's a real medical formulation that's used. And again, soft gels are great because they last for a very long time compared to combustible formulations. So again, really applaud Dr. Dahmer, Dr. Arnsten, and all the other people involved in this research, and for the amazing, and I'm sure we'll provide links for ways that you can register to be a part of this research if you're eligible. We'd love to put that out there as well. And want to really give another shout out to National Hispanic Cannabis Council providing this forum for experts like Dr. Dahmer to really share the research, the clinical knowledge that he's been gaining over the past, 7+ years. And Antonio, a huge shout out to you as well for really leading the charge, and the Medical Opportunity Committee as well. So thank you both so much.
No, it's an honor to have folks like you, your expertise, your passion. How can I not be accepted, but I think more importantly, what we discussed today really hits it on the nail as to what our goal and our mission is here at the National Hispanic Council. And that's really to demystify, at the end of the day, these long-held taboos. So the more that we have these sessions, the more that we can make them available for the public, which they will be, as you know, I think that our partnership and our story we're just at the beginning. And Dr. Dahmer, I commend you on the research. Keep plowing away on it, because I would love, when that study becomes available, if we can have a link for our constituents as well, because I think that the data doesn't get old, but I think always a refresher on what's new, and especially if the sample that you are doing it from is of the Latinx population. I think it can resonate for others, as they say. I don't want to be in that role, but if I can see it transferred from someone else, it becomes a very powerful story. Because I know from a cultural thing, some of the biggest roadblocks that we have as Latinos is asking the right question, and asking any question, because of the role of shame. But if you can do it in a way where it comes through the science and the population of that sample looks like you, wow, what a powerful story do we have to tell. So thank you both for this time, and I think we went over.
Well, real, Antonio, I want to add just two quick things before we do wrap up. Yeah, and one of them, very important for me is that this is a plant, right? And this is the first kind of medication, if we'll call it that is available to patients and even physicians that came from people, right? So it's really people that advocated for this to be legalized on state-based programs. And there are estimates now that there are 5.5 million Americans that have received a recommendation from a provider to utilize in state legal programs the first medication that I've ever seen that's come from people and not from another pathway, which also makes it a challenge that we're used to things coming down an FDA pathway. But I also just want to add too that while the memo trial wrapped up, we do have an ongoing trial right now called the Relief trial. And for the first time, this is a randomized double-blind control trial, 2 vouchers. So it's the gold standard, right, of medical trials, but looking at a higher THC versus a 1-to-1 versus a higher CBD versus placebo. And hopefully we can put a link to that because we are recruiting for patients to participate, again, mainly from the Bronx that this is occurring. It is a New York State based study, but we could use help with recruitment and would love to put that up and are excited to showcase the data. And the beauty of the data is that whether it shows it works or it doesn't, we have to share that data. And that's what we're looking forward to, is getting better evidence and better data to inform everyone that is using this plant.
I don't want to let the cat out of the bag, but as you know, we're still an infancy organization, but we are in the midst of launching our first local chapter. And it's going to be in New York, but it'll be based in New York City, representing the tri-state area. And only because of the movements and what we have seen as very critical, that New York is, that whole area, the tri-state area, especially New York, is in a critical juncture right now with the cannabis. And it needs, I think, more outreach organizations like us, so that more Latino practitioners have something to hang on to. But more importantly, for us, also the constituents of consumers to educate on the health and wellness of the plant. So that's coming. And if that becomes a local execution, we can definitely help pontificate for samples, because the membership, as I see it already asking, it's a very diverse group. And so hopefully, I think that wraps it up, Paloma. Back to you if you have any final words.
I'd just like to thank you again. Congratulations on the New York chapter. That's amazing news.
Well, we're still, it's in development, but today we worked through the bylaws and it's slowly coming together. But
congratulations on the announcement of the New York chapter then.
Thank you.
Very excited that we got to meet so early in your history. Happy to be a part of the early history, and excited for what's to come next. I know we're going to do more work together, and
absolutely more to come. There's 47 ailments, I think, that are on my matrix, so we're not going away. But I'm also mindful of your time, because I know you have a very busy plate, both of you. So, but whenever we find the opportunity, we'll come back. But I felt this was a very rich, insightful conversation today. So thank you. Okay, bye-bye.
Thank you, Antonio.
As they say.